So I want to thank everybody for coming, especially my colleagues. I'm really touched that you're here. My name is Sara Feigenholtz. I'm a state representative from the 12th District in the city of Chicago along the lakefront, home of the world champion Chicago Cubs. But that's not why we're here today. We are here today because there are a lot of people, including myself, who are very, very concerned about what we are hearing coming out of the child welfare system in this state. A series of tragedies and very difficult situations for families in this state and bad outcomes for children. And I think that we are going to form, although we do have an adoption and child welfare committee that's doing great work, we want to make this a bipartisan and hopefully maybe even a bicameral effort. We have a senator here, and to start working on major reforms to the child welfare system and help the agency and the governor's office so that this state can be proud of its child welfare system and putting children forward in successful, safe places. We filed an amendment today to Senate Bill 193 that addresses something we heard in some of the hearings was that we heard a lot of horizontal discussion about what the problem is, but we didn't hear a lot about the vertical accountability in the agency and who is reviewing reports. And what Senate Bill 193 does, its amendment, is it addresses the vertical accountability in this agency. And we want to make sure that there are other sets of eyes on these cases that are so difficult. It's going to tell us a lot about what's going on in these communities and the judgment that's being used and whether or not we need more personnel and more supports for these families if we are going to choose to keep them intact. The caucus is going to look at other models in the state and around the country, and we're hoping to modernize and improve this situation. We're going to work off of the Chapin Hall report when it gets delivered. We've been combing through the Inspector General report. We're going to talk to the advocates, and we are going to hopefully improve this system so that we don't have to experience what we experienced with Tanaje Barnes, with A.J. Freund, where we see gaps in the system, and we're going to try and fix it. I'm going to hand this over to Anna Moeller, who is spearheading this with me to speak a little bit and invite other people and people like the Foster Care Alumni of America to speak, and anyone else who wants to talk about the impact of this agency on their lives.
Thank you, Leader Feigenholtz. As she mentioned, I'm State Representative Anna Moeller. I represent the 43rd District. I want to thank Leader Feigenholtz, all of my colleagues, and the advocates for being with us today. As you can see from this turnout, this is an issue that resonates for all of us. For me, stories like A.J. Freund's are a little more personal. I was exposed to opiates in the womb from my birth mother, but unlike A.J., the state took me away and placed me in the care of my loving grandparents. And today, and after hearing about this case and so many others, I truly realize how lucky I was from that decision and how that changed my life. And it shows the contrast with, unfortunately, so many children who were not as lucky and didn't have the same opportunities. AJ was left in the custody of his birth parents, who apparently had similar drug problems and now are accused of beating him to death. It's clear that the state failed AJ, and it's clear that we must make changes and fix our child protective care system. Our main priority must be what is best for the child, even if that means removing him or her from their parents. We need to support and improve our foster care system and our adoption care programs. We need to provide appropriate resources so DCFS can do its job. And we can't let one more child suffer the way AJ, Tanaje Barnes, and all children who have been abused have suffered. But while we are eager for action, we must be clear that today is only the first step in many to come. We are forming the DCFS Child Welfare Reform Caucus and filing Senate Bill 193 to carefully move forward with reforming our system and not providing a knee-jerk reaction to the latest tragedy-grabbing headline. These are problems that are many years old. These children are often in situations that are incredibly difficult and complex. Abuse and neglect comes in many forms, and every child's challenges are different. Our system has to be more nimble and innovative and accountable to ensure the best outcome each time. So with that, I look forward to working with my colleagues in the caucus on this legislation. The children of Illinois know we cannot afford to wait or to fail them. Thank you. And our next speaker will be James, who is James McIntyre with the Foster Care Alumni Association.
Thank you, Representative Mueller and Representative Feigenholtz, for starting this conversation on how can we improve all lives of the kids who are currently suffering child abuse and neglect, and those that will eventually be at the hands of an abuser. My name is James McIntyre. I am the co-founder and current board president of the Foster Care Alumni of America, Illinois chapter. We are the only organization that is represented by Youth in Care and former Youth in Care to work on reform within the child welfare system. I'm going to share a personal story and why this caucus is very important to me to continue the conversation. At the age of 5, I was taken away from my biological family's home due to neglectful situations. By the age of 7, I was adopted into a household that seemed to be the perfect home for a family to grow up in. However, after that adoption, things stopped working. I was a target of constant abuse, being thrown into walls, hit with a number of objects, and sexually assaulted by the biological children that lived in that family. When I wasn't being assaulted or abused, I was being tortured in very similar ways that are currently being reported. Naked, cold showers, afraid, not knowing who to turn to. I turned to my neighbor in the time of need after about 1.5 years of living in that household, to which nothing happened. No investigation, no phone call, nothing. I lived in that house for 7 years, going through what Tanaja Barnes has went through, what Jahar Gibson has went through. Those stories are my stories. I could have easily been a face that the news shows of the tragedy what happens to abuse and neglected children. I could have been the face of what happens when we decide to only look at the cases instead of the system. That could have been me. At the age of 13, I left that household by ways of myself. DCFS did not intervene. The state did not intervene. This story is one of many survivors of childhood abuse tell. These are the stories of my members, of having to remove themselves from the family at the young ages of 13, 14, 12. As adults, we have a commitment to children that they should live in a household free of abuse and neglect. What we know is what the data shows us, that abuse and neglect targets every population, gender, religious organization. Abuse and neglect is a public health crisis in the state of Illinois. The Auditor General today released a report that showed that 39% of the cases of 39% of the indicated reports that the investigations have found that were indicated were not referred to any community resources. Now, what that says in normal people talk is we left families alone. We left families stranded. We let that kid know that their voice does not matter, and that although, yes, abuse is wrong, we as a state said, it's okay. We don't need to offer services. We don't need to offer support. We saw an increase in the hotline during the last 2 years of the Rauner administration after he cut services to mental health facilities, drug and addiction placements, and child care. And now we're suffering those cuts today. Now, I could sit up here and blame the previous administration, blame the last 10 directors for not prioritizing child welfare, but many of the elected officials and myself are moving past that stage of blame, moving past that stage of resentment, and how do we actually influence change? The Foster Care Alumni of America Illinois chapter is dedicated and working with the caucus on how they can reach out to their communities. How do we spot child abuse earlier? How do people make a hotline call? How do we save children's lives? And at the end of the day, as long as we can stand together as advocates and caucus members, communities from downstate to Chicago to Rockford to Rock Grove, Illinois, where I was abused, then we can do good by these kids. And we can do what we are meant to do and being the adults in the room, finally. Once again, I do want to say thank you to Sara, Representative Feigenholtz, and Representative Moeller, as well as the vast number of representatives behind me for taking the mission of the Foster Care Alumni of America and making sure that kids that are in the system are empowered, educated, and transformed. Thank you.
Is it MC, capital I-N-T-Y-E-R?
MC, capital I-N-T-Y-R-E.
I'll just say a few words. I'm State Senator Robert Peters of the 13th District, and I'll share a little bit about my story and what I think about this in terms of the fact that I was born deaf in 1985. My biological mom was addicted to drugs and alcohol, and I was adopted. I was adopted to a civil rights lawyer and a criminal defense for a father and a social worker for a mom. For me, when I think about this crisis that we are in, it's long-term, and it requires a long-term vision to deal with it. It requires understanding that it affects everyone's lives. It's not just simply the child, but the story and the background for why someone could get addicted, why they feel like they need to flex their power onto an innocent person. And dealing with this abuse and this neglect in this system, it's not going to take a snap of the fingers. It's going to take getting nitty-gritty to deal with. And I think for me to stand here with all these folks, all these allies, it's to understand that this is systemic and not one-off, and that this isn't something that will just be done this year, but something that will be done for a generation. I think about in Illinois, a 21st century where we don't talk about just the parents and the child and their story in a way that is about their struggle, but how we have uplifted them so that someone like me, I didn't have to be ripped from the hands of my biological mother due to her struggles, due to her drug addiction. When my parents were going through a terrible divorce and my adopted mother was dealing with alcoholism, and we were going through that split, and we had to talk to DCFS and make the decision of what household we're going to live in, that a close family member of mine, a sibling of mine, who was struggling through cancer, didn't have to decide between one who had health insurance and one who didn't in terms of a parent. It's the idea that we bring people together, we build people up, we lift them up. I want to see an Illinois where we don't have these stories anymore, so I'm not seen as an exception because I'm not exceptional. That we actually make sure that everyone is the rule of a good, safe, and dignified life. So I'm just glad to stand here and glad to be part of this vision because this is going to be a long road, a long fight, and I think each and every one of us are committed to it. So thank you.
Good afternoon. I'm State Representative Mary Flowers. And ever since 1985, when I first walked in these doors, I took on the issues of DCFS. And I must say to you, from 1985 up until now, it's gotten worse instead of better. But the past does matter. And the rules and what a lot of these families are living under are legislation that has been passed by this House, and the budget that has been passed by this House as well as the Senate. And unfortunately, DCFS came before the Appropriation Committee years ago. It was Jess McDonnell. And he said that it was in his best interest to maintain the children in the system longer to capture the federal dollars. That was the spiraling down. That is part of how we got here, because families were trying their best to keep their families together. And when we passed the intact legislation, it was to keep families together because we had 50,000 children in the system, and they were robbed. They were robbed of their childhood, they were robbed of their families, and they were raped, and they was passed all around the state. And we are living with the consequences of so many generations not having a family, not having anyone to care for them, not knowing their families. And I want to commend my colleagues for coming together today, but it's not going to be one bill. It's going to be a holistic issues. It's going to be lots of issues that we're going to have to address. There's things in place right now that could help these families that's not being implemented. There's services out there that's not being implemented. It's not about counting how many times that the investigations. We don't need anyone to count the investigations. We want them to solve them. There needs to be continuity. If you go into a house and the house is filthy, that is an indication that a problem has occurred and is occurring. If you go into a house and it's drug abuse and feces is all over the place, that's a mental health issue. Where is the issues or the organizations out there to help these families? Families don't just want to hurt their children. In Samalja's case, that family was asking for help. In the latest cases, these families had been in contact with DCFS. What did DCFS do? But I'm not here to put all the blame on DCFS. We all have a hand in this. And it's not a one-size-fits-all. It's not just DCFS. It's the Department of Public Aid. It's the Department of Mental Health. There's jobs. It's the low wages. It's the environment. It's the drugs in our community. There's a lot of things that's wrong here in the state of Illinois, and our children are suffering. We are the cause that a lot of families are split up. We are the cause that a lot of families are on alcohol and drugs. We are the cause that families have to work 3 part-time jobs and then still come home and take care of their children and be responsible and being put out of their houses and not having any type of help from the state. We are the cause. So I'm here today to let my colleagues know that I'm here to be a part of the solution, as I've always been in the last 34 years that I've been here in the House of Representatives. Thank you.
Thank you, Mary.
Good afternoon. I'm Representative Keith Summer. I'm the minority spokesman on the Adoption and Child Welfare Committee. I'm honored to serve with my colleagues here and honored to commit ourselves to finding solutions to these problems. This is not about politics. This is a bipartisan effort. We seek your help. We need you to talk. We need you to write. We need everyone to be involved. All those citizens of this state of goodwill and all those citizens who've been sickened by the tragic deaths experienced in recent months in Illinois. I congratulate Representative Feigenholtz and Representative Moeller for bringing this forward, to uniting us in a common effort to find solutions for those problems that people like Mary Flowers have been working on for decades. We are united. We seek and want the help of everyone. Thank you.
Anybody else? Any questions?
Sarah, 193 then, is this outside the agency scrutiny of individual cases where?
No, it's an internal review. with administrative supervisors that are out in the regions in the field. And it's a random sampling, 5% of indicated cases, children under 5 or preschool, where there's not an extra set of eyes on these kids. We're seeing a pattern that these are the children that are falling victim to this. So we're going to shrink the universe and try and focus on what is going on and how these cases are being decided, frankly, and involve actually the deputy of child protection. Right now, the way the organizational chart sits in the Department of Children and Family Services, any kind of reporting goes to the director of operations, and that has been a vacant deputy position for a very long time. So I think we're trying to, this already could be in regulation, but it's not being utilized. So we are writing this law to create checks and balances so we can review and take a look at how some of these decisions are made and if there is a chain of command supervising them.
I was going to say, I think the deputy to whom you refer testified at your committee last week that there was a miss in AJ's case where he made these comments to the doctor about being beaten, that was a missed thing, that a child abuse expert, don't those resources already exist in the agency?
Yes. I believe that in the 300-page book of regulation that there is a description of how this should have worked and that the supervisor should have signed off on it. In the timeline that we are receiving on all of the cases that the department is providing, the missing piece is the chain of command. We don't, who approved this? Tons of questions come out in these cases, but I think that the accountability is really more of a concern to us because we've seen this problem in many of these cases. Where was the ball dropped?
Is there a way outside of just trying to hold a bureaucracy accountable to actually go after some of these investigators who may have dropped the ball and hold them somehow criminally, liable?
Well, I don't think we have enough information yet. I really don't, and I have to say that that's a very good question. I'm not saying that it's irrelevant, but we're focused on protecting children, and I can't believe that I think that any investigator who would venture to take this job would have ill will. I think that there is so much stress on this system. I think that James was talking about the Auditor General's report and what has happened to this agency. Not having a budget and not having enough staff, spikes in opioid addictions around the state, tons of incidences. The report is very telling. That I just think that there wasn't enough capacity in this agency. So before we talk about criminal intent or that kind of thing, I would really like to get a sense of, maybe, the 126 frontline workers that the governor has proposed. But, we are recovering from, 2 or 3 years of no money flowing to these agencies when Bruce Rauner was the governor.
But, there's a difference between having ill will and purposely going out and harming somebody versus malfeasance or just not doing the job.
It's something that I'm not focused on, but I'm happy to think about. But right now, we just really want to avoid another case. We want to be able to create a check and balance system and close the gaps and help the agency and give them the tools that they need to do this.
No, Representative Flowers, you talk about the incentives that some were saying years ago, hey, we have kids involved, we get money from the feds, how can we disincentivize, dropping the ball or...
I want to answer your question first. Yes, there has been people that has been locked up for violation of falsifying information. And if you Google, it was probably back in the early 2000s, there was a court case that held a caseworker responsible for falsifying information. And when you look at the cases, you will see plainly and clearly that there has been falsification of information in regards to these families. Now, you have to realize that these people that we're contracting with, excuse me, we're paying them. We're paying these outside vendors to protect our children because DCFS can't do it all. They have the specialty. They're supposed to be responsible, and they are dropping the ball. They are not doing their due diligence. So I agree with you 100%. There needs to be more accountability in the system. We could do the checks and balances as to who's responsible, but there is mandating reporting. That is already the law. That's the reason why I'm saying there's so many things out there, so many policies, so many rules, so many regulations, so many federal watch. We have been under a federal court watch for the last 30 some odd years or more. 30 some odd years.
How can we,
Thanks, Mary.
how can we do anything? The audit also mentions that the caseloads were violated by the federal consent decree. It's a federal court saying you have to have this number. It's very, to a layperson, to a taxpayer out there, that's a very simple thing to fix.
Well,
Why
right,
would we
yeah.
ever-
I mean, entities are constantly running into court. We have a special master now in Illinois. I'm sure you've heard of that. That is actually one step off from like receivership. That's the essentially how sad our situation is and some of the other points that came out from the Auditor General's report that we're all going to be looking at to follow up is like 50% of the hotline calls go into voicemail and need a callback. So for emergent cases where children are really in trouble, that's a huge problem. The number of investigations that were indicated dropped 28.3% in 15 to 23.8 in 16. However, the percentage of investigations that weren't completed within 60 days, which is statutory, went from 7.6% to 12.4%. So there's every indication here that there are problems when it comes to the investigators. They didn't always document the assessed need for services. There are 13 recommendations. This was just filed this morning at 10 o'clock, and these are things that we are going to look at. 13 recommendations from the Auditor General is a lot. So, and this is simply in the for investigators.
Now, this is going to cost money, I assume. How do you reconcile that with, well, you all Democrats are just tax and spend? How about there's some of the Republicans up there that probably don't want to increase taxes? And by the way, cut 4, 5, 6% out of everything starting right now. How do you reconcile those 2 points?
Well, first of all, when I chaired Human Services, I remember during the Blagojevich administration, the first day the new director was on the job, I believe he cut the DCFS budget by $200 million. I think this agency used to get automatic COLAs. Now that's not happening now. Then we went through some cuts during the Quinn administration and some of these programs, and then it was the perfect storm. Then then Bruce Rauner became governor, and I don't have to tell anybody in this room what happened then. So there's Representative Flowers was talking about the 85% of our cases our regions delegate them to not-for-profit agencies. Those agencies cannot compete and have competent staff to do this work. They have not seen a cost of living adjustment or a rate increase in 12 years. There is a piece of legislation, a budget bill that Representative Chair Gable is sponsoring that many people are very supportive of, that is going to fortify those agencies that we delegate responsibility to. And if we don't give them those resources, we have to revisit whether or not we are going to continue to keep the criteria for intact families with them or move them into the agency. because I feel as though some of the work we're giving them to do is irresponsible on our part. I really do. And so I would really like to see that 30 million in the budget. I'm not even sure that 126 workers for frontline workers is going to do the job, but we also have to build more resources into the Human Services Department for substance abuse treatment and mental health services. We have to rebuild this whole infrastructure, and these agencies have to start to talk to each other and collaborate. To answer your question, you know, I'm not sure that there's been a lot of talking going on. And I'm hopeful that in this administration, there's going to be a lot more collaboration. I know that doesn't exactly answer what the budget question, but I think that a budget is a moral reflection of the heart and soul of a governor and a legislature. And if we are going to pass a budget without this increase for our agents that we enlist to do this work for us, then we should rethink our purpose here. You know, I'm not sure we're prepared for that. I mean, I think local communities have a greater sensitivity to people in their communities, and that, you know, I've seen it work when there's resources. There are models out there where reunification programs have a very, very deep service package around substance abuse treatment. There are intact programs that work. It's not happening for a whole plethora of reasons in this state, and resources and tools are certainly one of them.
I would like to say that, with all due respect to my colleague, and we've been arguing for years, and we're not about to stop today, but to say I agree that not only DCFS workers and the private agencies need an increase. There's mental health, they need an increase. Mm-hmm. There's doctors and hospitals that need an increase. But that doesn't stop them from doing their job. That's the point. And if you cannot do your job, if this tell the parents who's trying to work and survive that they are, can they use that as an excuse, the reason why they're abusing their kids because they haven't had a pay increase? I don't think so. And so, with that being said, I would love for everybody to have a pay increase. But intact family, I just need for my colleagues to also know that I have a resolution coming out confirming what the federal government is doing in regards to intact family. They're going to give the state of Illinois more money to make sure that the services are provided in the family, not outside the family. Because that's exactly what happened in the 90s. We broke up the families. We called the grandmothers liars. We said we passed laws that said that you cannot put these kids in home of family members if they had a record or some type of background. And so the only thing we were doing was increasing these private agencies to come in and do what they're doing now. Now, don't misunderstand me. There's some good private agencies out there, and then there's some out there that's just collecting the paycheck.
Sir, these groups that you've talked about, Mary's talked about, they don't exactly have very strong lobbies. I don't believe Mr. McIntyre's organization has a lot of money to pass around for campaign contributions. He's the my point being that at the same time, taxpayers want this taken care of. They don't want to read these stories anymore.
That is correct.
And so, you know, what does it take to get priority for? I mean, we're talking about capital construction. Yeah, we need an infrastructure program. Do we need a social services infrastructure program? Am I right that, I mean, you're closer to your constituents and
Yes.
taxpayers than I.
I mean, I think that's certainly a larger conversation, and it's very difficult to say that DCFS deserves more than any other sector that's been devastated. But I have to say that some of those other sectors have seen increases. But this agency hasn't seen one in 12 years. And I do not think that the POS providers have there's nobody else who has seen, who has not seen an increase of some kind. So I was actually surprised that this didn't happen last year. And unfortunately, hopefully we'll learn from the experience of these recent deaths that we have to do this now. We have to act now, that we can't roll our sleeves up and look at things that much anymore. We have to take active steps to fix this. It is a paralyzing situation we're in. And I realize that a lot of people just don't even know where to begin. And I think that everybody standing up here today is ready has the same attitude, that they want to see action taken. And we're all going to work together to do it.
Thank you for watching the Illinois Channel. You may also wish to follow us online, where you are free to make comments or program suggestions. Get our breaking news updates on Twitter, where you can find us at Illinois Channel. You can find our past programming on YouTube at youtube.com/Illinois Channel TV. Or you can go to the Illinois Channel website at illinoischannel.org. There you can find not only our current video stories and programs, but also our library of past programs, as well as articles that provide additional information about Illinois issues and individuals. The Illinois Channel, keeping you connected to your state, your issues, your home.